And welcome to our continued coverage of the Telehealth and Remote Monitoring Technology Showcase here at the Rayburn Building in Washington, D.C. We're joined by Anura Fernando. He's Principal Engineer at UL. And Anura, welcome to the program.
Thank you.
Thanks for being here. I know that UL does a number of things in the testing space. I want to ask you specifically about the telehealth space and public safety, and maybe what, if you can, give us one of your principal challenges when it comes to public safety and telehealth.
Sure. So UL is very focused on public safety, and in particular, we've been looking at megatrends in healthcare. One of the things we started to notice around 2010 when we participated with the FDA Summit and Continua in their Interoperability Summit is that there's this growing trend of people wanting to age in place as the aging demographic grows. Also, telemedicine being able to support healthcare in remote locations where clinicians aren't readily available and so forth. And the risks associated with those, both having the presence of new technologies that support telemedicine, as well as risks to people who don't have access to medical care because of the lack of telemedicine and related technologies. So really the biggest challenge has been trying to find that balance between addressing technology-related problems that can cause harm and being able to facilitate rapid deployment of innovation into society so that people who aren't receiving the care they need aren't harmed by virtue of the fact that they don't have access to that care. So it's been a very tight balance to attain, and we've been trying to work with a number of stakeholder groups, industry, manufacturers, the regulators themselves, users of the technology, to understand what their challenges are. And then we've been working collaboratively with the Association for the Advancement of Medical Instrumentation to publish a new series of standards that try to address these issues having to do with devices connecting to one another and providing care in remote locations, as well as devices connecting to one another in an integrated medical environment.
Now, of course, we're standing here at the Rayburn Building on Capitol Hill. What can Congress do to help support your initiatives?
Yeah, absolutely. So as we develop these kinds of standards, one of the things that would be very helpful to the overall market and ecosystem is aligning regulatory processes with these kinds of standards. Currently, if you have multiple vendors bringing new technologies together and unique new ways to promote telemedicine and integrated technologies in healthcare, the regulatory process was originally geared toward single products and clearing single products onto the market. So now if we can find ways to engage with such standards as well as third-party testing and certification to supplement or support the regulatory process, then we can facilitate these kinds of integrated technologies being more widely used and adopted in industry and more readily accessible to the market.
Now, I mentioned, as you well know, this is also, well, part of this showcase, technology showcase, is remote monitoring. How does that play a part in what you guys deal with at UL as far as the aging population?
Sure. So remote monitoring is one of the key aspects of allowing the aging population to do what's called aging in place. So as people age, they would like to be able to stay in their homes, not necessarily go into care facilities or nursing homes, those kinds of things. And so having technologies available in their homes that then provides data to their clinician or their physician in the hospital so that the clinician can then change their medications or provide other regimens for them to follow without them having to necessarily get out in inclement weather and travel and put themselves at risk to falling and breaking a hip, if it's icy conditions, things like that. All of those things are enhanced and facilitated by the kinds of technologies we're seeing at the show here today.
Now, you mentioned earlier that there are certainly benefits of interoperability of all these devices in the telehealth space, but there's also some risk in the interoperability. What did you mean by that?
So whenever you deploy any technology, and in particular highly networked technologies, things that use your Wi-Fi connections and things like that to gather your health data and transmit them to a hospital, you have issues to worry about like privacy and confidentiality of your personal information. you also have the opportunity for malicious users or attackers to come in and take control of things like your pacemaker, for example, and do nefarious kinds of things to cause harm for a variety of reasons. You know, it may be from a national security perspective, looking at healthcare as part of our critical infrastructure, or it just may be people trying to create a name for themselves in the hacker industry, trying to prove that they can get into certain types of technologies. But either way, we want to protect this core part of our critical infrastructure that is healthcare from those kinds of problems. Also, when you communicate data from point A to point B, there's always a natural corruption of data. There's electrical interference with radio waves in the air and perturbations on the electrical supply and things like that that cause these ones and zeros to become corrupt. And those kinds of corruptions can result in patient harm if they're not identified and addressed and that potential hazard mitigated.
Nora, thanks for your time.
You're welcome.